Um, you know, we can't leave our talk today without talking about GLP-1 medications,
Mhm.
and whether it's Ozempic, Mounjaro, tirzepatide, all of those. How do you integrate these tools safely? And what do you tell patients when they're thinking about an injection, or now I read you can take a pill, and are they going to get fixed without a lifestyle change?
So we have patients that come to us very, very often that inquire about, the GLP-1s or the weight loss treatments. They are a novel medication. They're the first of its kind to not attack, but to work in 3 different ways to improve weight management. So they work at the level of the brain to reduce hunger and appetite, as we know. They work at the level of the pancreas to improve insulin function, and they work on gut motility so that when you're eating, you eat less, you feel full faster. And so this really attracts patients because before, weight loss medications were all about speeding up your energy, lowering your metabolism, and almost they got you wired in a way.
Mm-hmm.
These medications don't do that. And so when I evaluate a patient, I make sure that they are, first of all, that they have pre-existing conditions that may help and may be reversed when patients lose weight, like high blood pressure, like cholesterol, like diabetes, and pair that with their clinical presentation. Are they overweight? Do they need to improve their metabolism? And so really looking at the full picture and creating a plan for them is so important. Oftentimes, I start patients that are good candidates on the lowest dose. And I tell patients, it's not good to lose weight overnight. It's not good to lose 15, 20 pounds in 1 month. This is not good for you. It's not good for your skin.
Mm-hmm.
It's not good for your body. It's not good for your pancreas or your gallbladder. It really throws the body into, into shock. And so I counsel my patients that to lose weight over time in a more progressive and conservative fashion. And that allows me to also discuss lifestyle interventions like exercise, like diet and nutrition, like sleep, rest and recovery, mindfulness, social engagement, all the things that contribute to longevity and wellness. And so it's not a one solution to change your life. It's multifactorial. It involves many things to really achieve sustained and effective and safe weight loss.
If you mentioned about the speed of weight loss and how it affects your skin, and how I've certainly seen people that have taken this and they've lost a great deal of weight, and they end up with far more wrinkles and sagging skin, and at least the parts that I can see when they're clothed, and I don't know what it looks like without clothes, and probably don't want to see it. But how does the using a lower dose, and over time, does that help eliminate or reduce the amount of the sagging skin, or how you get more wrinkles in your face if you're not as full-faced as some of us are? Yes.
It does. Using lower doses over time in a more conservative way it helps the body have more balanced weight loss. We know that your skin needs, to a certain degree, it needs fat cells. It needs lipids. And so when you lose weight too dramatically, your skin responds by losing collagen, losing that supple composition of the skin, and also it loses energy, right? Because most people some people that are losing weight stop eating protein, stop eating peptides and and collagen and protein shakes. So your skin needs all of those nutrients. It needs peptides, it needs proteins, and at a certain degree, it also needs fat and hormones.
Mm-hmm.
We know that that fat is where a lot of our reproductive hormones are stored, such as estrogen and testosterone and the others. And so oftentimes women that lose weight too dramatically, you can tell in their face because their face is depleted of fat now, meaning less hormones in their skin. So it's sort of multifactorial and it's pretty complex.
Yeah. So slow and steady is always better.
Slow and steady is always better. Absolutely.
There you go. A new phrase for us all to live by.